Good evening and welcome to this regular meeting of the West Ada Board of Trustees. As is our custom, we'll begin by reciting the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Before we begin, Clerk Newbold, are there any changes or amendments that you have?
Chairman, Trustees, Superintendent Reynolds, I have attached all the documents that have been received. I have not attached the patron comments as of yet, but they will be attached tomorrow. Thank you.
Thank you. And I'll actually wait for realize I ought to wait till the next item to do the trustee agenda approval. So we'll move on with item A, which is the reorganization and the administration of the oath of office to our new Zone 3 trustee, Sheena Buffy.
I, Sheena Buffy,
I, Sheena Buffy,
do swear that I support the Constitution of the United States,
do swear that I support the Constitution of the United States,
the Constitution and the laws of the state of Idaho,
the Constitution and the laws of the state of Idaho,
and that I will faithfully discharge all the duties of the officer of trustee
and that I will faithfully discharge all of the duties of the office of trustee
of West Ada School District and Ada and Canyon Counties,
of West Ada School District and Ada and Canyon Counties,
the state of Idaho,
the state of Idaho,
according to the best of my ability.
according to the best of my ability.
Welcome to the West Ada Trustees.
Thank you.
Go ahead and take your seat there. Thank you.
Well, welcome, Trustee Buffy, and look forward to the good things you're going to do for the children in West Ada. With that, then, do any trustees, including Trustee Buffy, have any changes or amendments to the agenda? Seeing none, then, we'll move on to Part B, which are the recommendations for new principals, and the first one is for the interim principal for Joplin Elementary School, and Mr. Myers is going to present that.
Chairman Newhoff, trustees, and Superintendent Dr. Reynolds. This evening, it is an honor to represent the learning community at Joplin Elementary. Before I share the recommendation for interim building principal, I would like to recognize the professionalism and dedication of the Joplin team and their leader, Dr. Brandon Gallagher. Dr. Gallagher's leadership, excitement for learning, and collaborative approaches to meet the needs of all learners at Joplin Elementary is greatly appreciated, and he will be missed. West Ada wishes him the very best and supports the difficult decision made to support his family. I also want to thank the leadership team at Joplin who collaborated as an interview committee to provide insight and focus on the values, goals, and the successes of Joplin. These commendable members were Kirsten Pekovich, Tristan Mayer, Kristen Cottier, Melissa McCumber, Megan Shaw, and Sarah Brock. With this, it is an honor to recommend Christopher Kelly as the interim principal at Joplin Elementary. Mr. Kelly comes to West Ada by way of the San Jacinto Unified School District in California, where he is principal at Estudio Elementary. Prior to his principal experience, he was an assistant principal at Megan Cope Elementary, lead third grade teacher for San Jacinto, and master sixth grade teacher at Oxford Preparatory Academy in Mission Viejo. Mr. Kelly is an instructional leader focused on the work of PLCs to ensure academic, behavioral, and social-emotional success for all learners. His dedication to safe and collaborative school culture is evidenced by his visibility at school and partnerships with parents and the community. Mr. Kelly establishes trusting and collaborative relationships with staff, which was quickly observed during his interview with the school team. He made immediate connections with the leadership team through humor and discussions about strategies for building positive, learner-centric cultures, lifting the morale of our teachers and staff, and prioritizing our instructional responses to COVID-19. We are looking forward to welcoming Christopher Kelly to the West Ada School District and celebrating with the community of learners at Joplin. Mr. Kelly is able to join us via conference phone this evening and would like to share a few words and respond to any questions you may have. Thank you.
Thank you, Mr. Kelly. The floor is yours.
All right, board, Dr. Rettel. Hello to everybody. Let me start off with just how excited I am to join. Can you hear me?
Yes.
Oh, thank you for, I'm looking forward to joining the West Ada team. I was so excited that visiting my family there this weekend, I had the opportunity to drive by the school not once, but 2 times. The neighborhood is beautiful. The campus looks very welcoming. As a new member, I want you all to know that I have a student-centered focus. I have an ethical and moral obligation to serve our students and ensure that every student gets what they need based on the MTSS and PLC processes. Through the interview process, I was able to meet many of the leadership team, both at the site and at the district level. Everyone has been so nice, extremely supportive, which makes me even more excited to jump in and do the work with this team. I'm also excited to meet the kids. I thrive on building relationships and understanding the best way our students learn, and I feel that knowing the students is one of the best ways to understand how they learn. There's a lot of work ahead of me, I know that. I'm thrilled for this opportunity. My family is thrilled for me. I appreciate the opportunity that you're providing for me, and you're making the right decision with bringing me on the team, and I look forward to meeting everybody.
Thank you, Mr. Kelly. Do any of the trustees have questions or comments for Mr. Kelly? Well, I'm not seeing any, but I think everyone would join me in welcoming you to the West Ada community and look forward to the great things that are going to happen at Joplin. So, and we appreciate you being able to join us this evening.
Thank you.
With that, then we'll move on to Part B of Section B, which is the recommendation for the inaugural principal at Owyhee High School, and Mr. Stans is here to introduce that person.
Well, good evening, Chairman Newhoff, trustees, and Superintendent Reynolds. Whenever it is announced that there will be a new school in the community, it evokes excitement and anticipation, especially when the school is a high school. High schools are the focal point and pride in our communities, with their strong foundations in athletics, co-curricular activities, the arts, and the wide variety of academic opportunities. In high schools, traditions are created and celebrated for years to come. And I was reminded of this recently when we celebrated my father's 80th birthday. When he reflected on his life and shared many of the highlights, several were from his high school days at Bora High School. 59 years ago, Bora High had just been built. My father was a member of the second graduating class. Today, you can go into Bora's gym and see banners that celebrate the students and teams of then and now. And tonight, we begin the legacy of Owyhee High School with the recommendation of the school's first principal. It is an honor for me to recommend Cliff Rice for this important position. Mr. Rice has invested 19 years with the West Ada School District, which includes being a high school physical education and health teacher, a high school activities director, a high school assistant principal, and principal at Mount View High School the past 4 years. Mr. Rice's passion, dedication, and commitment to excellence have been clearly demonstrated over these years. We are confident he will assemble a winning team of teachers, coaches, and staff who will quickly become the pride of their community. In short, Mr. Rice is ready to take Owyhee High School by storm. At this time, I would like to invite Mr. Rice to the podium as he has a few things that he would like to say. Thank you.
Mr. Chairman, trustees, Dr. Reynolds, First off, it is an absolute honor to be standing here before you today as the recommended candidate. Pending your decision tonight, I just want to let you know how excited and how much I look forward to starting the traditions that Mr. Stans referred to, creating just an awesome staff with the focus on students and the amazing culture that I believe that we can start at Owyhee. So thank you again for this recommendation, and look forward to the decision.
Thank you, Mr. Stans and Mr. Rice. Do any trustees have any questions or comments for Mr. Rice? Trustee Johnson?
Thank you, Mr. Chairman. I have an appreciative comment. So I think one of the things that when I first heard that Cliff was, or Mr. Rice was a recommendation, my heart sank a little bit because he's been such a great principal at Mountain View High School. But the more I thought about it, the more I was encouraged by this. One of the things that Mr. Rice has done is created a culture at Mountain View that is very inclusive and collaborative and trusting. And I appreciate that, and I'm looking forward to the fact he's going to spread those skills to the next layer of our new high school. And so I just wanted to say thank you for that.
Trustee Johnson, thank you very much. Appreciate that.
Anyone else? Well, thank you, Mr. Rice, and we look forward to your continued efforts in West Ada.
Thank you very much.
That brings us to the consent agenda, and I would entertain a motion with regards to it. Trustee Azuna.
Mr. Chairman, I move that we approve the consent agenda as submitted.
Thank you, Trustee Azuna, for the motion. Is there a second?
Second.
Thank you, Trustee Johnson, for the second. Is there any discussion? Seeing none, then I'll entertain a vote. All those in favor, please say aye.
Aye.
Aye. And opposed? I don't think there are any, so it's unanimous. That brings us to the discussion, and the first item is revised policy 803.20, disposal of surplus real and personal property. And I believe that Mr. Yocum is on the phone to present this.
Thank you, Mr. Chairman. Members of the board, Superintendent Reynolds. The revisions that you see this evening in policy 803.20 will align our policy with Idaho Code. Most of the revisions that you see tonight were made by legal counsel, and then the entire revised policy has been reviewed by legal counsel prior to the meeting this evening. So to sum up, the policy revisions are an effort to align our policy with the state statute. Thank you.
Thank you, Mr. Yocum, and I'll note an unusual aspect of this for the trustees is that this is on the agenda as with basically one reading. But if there's significant discussion and people want to hold it over, of course, we would have that option. So do any trustees have any questions for Mr. Yocum? Well, seeing none, you got off easy tonight, Mr. Yocum. Thank you for joining us.
Thank you, Mr. Chairman. Thank you, members of the board. Have a good evening.
And that brings us to discussion item B2, the Pandemic Operations Plan, and I believe Mr. Heller is going to start the discussion on that.
Thank you, Chairman Newhoff, trustees, and Dr. Rannells. We are here tonight to bring forward our revised and rewritten Pandemic Operations Plan for your consideration. I do want to start by recognizing the hours that many individuals have put into the work of not only the rewrite of this plan, but more importantly, finding ways to operationalize the plan and to identify the processes with which we can monitor that implementation. I want to recognize the COVID Task Force, the district executive team, our partners at Central District Health, and the medical professionals who provided input into our plan. I am going to ask Dr. Pate to come up at this time and speak to the plan and the process. I think it's very important that we recognize Dr. Pate for how generously he has donated his time and his expertise to our district. He's gone above and beyond the call of duty, and we're extremely thankful for the partnership that we've established with Dr. Pate. So at this time, I would turn over my time to Dr. Pate and his remarks.
Thank you, Chairman Newhoff, Superintendent Reynolds, and trustees. Much work has occurred since I provided you with my first report at your meeting on October 27th. First, we concluded a rewrite of the pandemic operating plan. I now believe that that operating plan is best in class for a number of reasons. First, I mentioned to you at that meeting that a partnership with parents was critical for the success of our schools. Obviously, schools benefit when parents role model good behaviors and reinforce messages with their children, and schools are placed at higher risk when they don't. This is the first plan that I have ever seen, and I've seen a lot, that actually provides guidance to parents. It is always hard to get people to change if they do not understand the need for change. This is the first plan that I have ever seen that explains the why for the changed behaviors we desire. Most plans I have seen throw a lot of information at people, but just reading through the plan, it would be hard to come up with what are the top 3 most important things I need to do. This plan is explicit about and emphasizes the 3 primary mitigating measures repeatedly through the plan: masks, distance, hand hygiene. We even included a section in the plan which explains to leaders, teachers, staff, and parents what are the most important things to know, and list those out. So I hope they'll read the whole plan, but if they don't, at least it's all right there in a section for them. Fourth, most plans I have seen are confusing because they go back and forth between colors and categories set out by the public health districts and explain the operations under those conditions. Given that by the time I was engaged, we were in red or category 3 with no likelihood of changing category for many months, we eliminated all references to these colors and categories and provided only the guidance that was for the red or category 3, shortening the plan and making the plan much clearer. And when the time comes that we can move to another color or category, it'll be easy to revise the plan for our guidance and the new information. Plans that I have reviewed often start out with guidance for schools with the students in classes. This is the first plan I have seen that provides guidance to parents and teachers as to the preparation for the day before the school day even begins. Further, getting to school and leaving school represent risk points that are rarely addressed by schools, but our plan does. Finally, we have organized the plan such that the main body of this plan is information that we believe everyone should read and be familiar with. We have taken the specialized information that relates to contact tracing, choirs, bands, physical education, special education, and the such, and put them into appendices to the plan labeled as references so that those with a need or interest can seek that information without having to search through the plan for information buried within it, if it even exists, which is common with other plans. I won't go through the plan, but I will be happy to answer your questions in just a moment. I would like to direct your attention to Section 2 of the plan, a part of the plan that I am very proud of. Unlike any other plan that I've seen, this explains what we currently know about the modes of transmission. Rarely in other schools' plans do I ever see reference to aerosol or airborne transmission, yet this may be the second most common mode of transmission of this virus, and it may account for the greatest number of cases of infection across the globe. In fact, one of the things we have focused on at West Ada that I have seen very few other schools focus on is prevention strategies for airborne or aerosol transmission. Many schools wrote their plans back in the late summer when we understood far less about airborne transmission. In fact, it took a long time for the World Health Organization and the Centers for Disease Control to even acknowledge the risks associated with airborne transmission. But with the benefit of more knowledge about this, we took significant efforts to improve ventilation in our schools. The standard for schools is generally 3 air exchanges per hour. In other words, the air in a classroom would be refreshed and replenished every 20 minutes. But commonly, schools are often found to have air exchanges when they're tested of only 1 to 1.5 air exchanges per hour. For comparison purposes, a typical home would have 0.3 to 0.5 air exchanges per hour. In West Ada schools, I have asked that we increase the exchanges to at least 4 times per hour, and in higher risk areas, we are doing 6 air exchanges per hour, which is the very best advice. All of our schools also use fresh air rather than recirculating the air. And I think this, in no small part, has been responsible for the success that we've had in minimizing in-school transmission of the virus. Our plan is really one of layered protections. The foundation of the plan is that teachers and students remain home if they are sick, though we know we will still have people show up to school infected, but asymptomatic, or with symptoms that they actually don't attribute to COVID. The next layer of our plan is to facilitate hand washing and hand sanitizing. The next layer is distancing. We know that this is our biggest challenge, but we are successfully distancing students 1 meter or 3 feet. And while 2 meters or 6 feet is our goal, we know that the highest risk of transmission is within that first 3 feet. Our next layer is masks. When one person wears a mask, we get something on the order of about 70% protection. But when everyone wears a mask, that protection goes up to about 91%. Then we add our last layer, and that is the ventilation or air handling measures I just described to you. I want to thank Ramona Lee, who is the director over special education for the district. Special education is one of the greatest risks for schools, and as I understand it, was one of the contributing factors to Boise School District deciding to go remote. I spent a lot of time talking to Ramona, understanding the challenges of special education, and researching options, including reaching out to the Idaho Council for the Deaf and Hard of Hearing, and together we came up with a number of innovative ideas to help make special education safer. I also want to thank Char Jackson for organizing a webinar that I recently conducted to explain the pandemic operating plan to leaders, teachers, staff, and parents, and to answer many questions that we received from the audience. At this point, I will pause in my report to see if any of the trustees have questions about the pandemic operating plan, but I would like to address the return to full in-person middle school classes separately and as the next part of my report.
Do any trustees have questions for Dr. Pate so far? Trustee Azuna?
I do. Sorry, I have a few questions related to the return for middle and high school, so I'll save those.
Okay.
But with the rest of the plan, I've received quite a few emails of concerns related to children that are not wearing masks. And this is specific to temperature checks, arriving at schools at different, there's a section in this. Can you go through that a little bit and also address the legalities related to that?
It's a great question, trustee. And as the team and I have discussed, our biggest threat in schools is when children aren't wearing masks. And so we particularly focus on situations where that might be. Special education, lunch times when you're eating and drinking, or mask exemptions. And so we certainly have looked at the classroom situation because that pertains to everybody. And there we have, when we have to have children taking their masks off, we have to be extra diligent about the distance. And we have found some problems with that when we do the walkthroughs, and when I get to that part of my report, I'll talk about that. But we've also found some ways to point out some possible solutions for those schools about that. So that's a risk. In the special education, that's a huge part of what Ramona and I have discussed. And we've come up with some ideas for sometimes when particularly teachers feel it important that the student can see their lips, see their tongue moving to form words or sounds. And so we've talked about that. That's why I reached out to the Idaho Council for the Deaf and Hard of Hearing, because I thought they would probably have some good ideas for us, and they did. And so we put into the plan the recommendation when that's necessary, then we try to do one of two things. One is have the teacher use the clear mask, which is a mask that has clear plastic here, but still a well-fitting mask, which should reduce the transmission possibility, but allow students to see. Or there's another mask called the Rafi Novi that is cloth-based, but has a clear window. We've talked about in situations where there are too many students that need to see that would require them getting too close, or a situation where it's not just the teacher, but the student also needs to have the mask off. There are going to be some of those situations we can't remedy, but where we can, one of the ideas we came up with is if we could have the students put more distance, but then go on our Teams program where we had the video and use it in the same classroom, but allow the students to see the teacher's mouth moving, but with more distance. So that's how we've addressed that. I've looked at special education classrooms in 4 schools now, and they're really doing an amazing job. It's not perfect. I don't think you can make it perfect, but they have really done some really good things there. The last one, which is of great concern to me, is mask exemptions. Although people indicate that there's lots of medical reasons for it, when we talk to various experts in various medical fields, there really are not many good reasons for a mask exemption. And we have to understand, every time we grant a mask exemption, we are putting people at risk. The worst would be when that mask exemption is not really for a medical condition, but really because of personal or political beliefs, because in that situation, there also may be accompanying behavior that's putting them at actually higher risk. So we certainly want to minimize mask exemptions. We've talked about that as a team. We've tried to come up with some ideas. That one's a very challenging one. I think that the team is looking at ways to make this as, for example, as part of a IEP or other plan, and we might be able to handle it better, but that is a huge risk. So far, it has not been an issue at any of the schools that I've visited so far, but we're in the process.
Thank you for that. Just one follow-up. And this might be a question for Mr. Heller, one of the regional directors. I don't know the volume of students that we have in our schools today that are not wearing masks, but with what we have listed in our plan around temperature checks and symptom screening and entering and exiting from other doors, do we have the staff to be able to manage that process?
Mr. Chairman, trustees, At last check, I thought in our 56 brick and mortar schools, I think we had 100, just over 100 mask exemptions across all of those. Most schools have a handful, and so our nursing supervisor does believe that that is something that can be managed. In the health services office, we also have it written that a designee could be utilized for those temperature screenings. So typically in a office, there are the nurse plus a couple other folks who are trained to do certain parts of the health service tasks to do those. So they do believe that's something that they can facilitate as part of their daily operations.
Okay, thank you, Mr. Heller. And then legally, given the higher risk of the students that are not wearing masks, can we do this separation for these students?
Mr. Chairman and trustees, based on everything we've heard from from council, from ISBA, from other folks, there doesn't seem to be any concern there. We are simply adding a layer of symptom screening just to make sure that we don't have, there are some districts who are doing symptom and temperature screening for every single student as they walk in. We're doing it for those who potentially could be at the highest risk category for our safety protocols. So that's, we haven't seen anything that says that would be something that would be a problem for us, but I think we can certainly research that more if you'd like us to.
Trustee Buffy?
Thank you. I also have a question probably best suited for Mr. Heller. Are the Clear mask and the Raffi Nova mask being provided to special education staff and students? Because it's my understanding that those are quite costly.
Mr. Chairman and trustees, we have two different versions of the Clear mask that Dr. Pate referenced, and they have been made available. Typically, for the most part, those are being used by special education staff, but when there's sometimes some challenge in getting enough of the smallest size of that particular mask, but yes, we do have those made available, and we have been getting those out to schools. We have some schools testing them out. As we were out doing some walkthroughs, we showed some to some of the special ed staff. They were very excited about the opportunity to have those instead, especially those who were relying on the use of a face shield, which we have now kind of said is not going to be something we'd like to continue, so this is a new option for them. And so yes, we are making those available as needed for the folks who need them.
Anyone else? Trustee Johnson?
Thank you, Mr. Chair. These will be quick questions, I think, and I don't know, Dr. Pate, if you will know this specific fact, but if you do, it'd be helpful.
Okay.
The fact we quoted was when both people are wearing masks, there's a 91% chance that the COVID will not spread if they're in contact. When we allow a mask exemption, how much does the risk increase for COVID spread within the school? Do you know?
So we don't know exactly what it'd be, but if there was someone in this room without a mask on, then we would have two risks. We would have a risk of droplet transmission, and that is that risk that we use that 6-foot guideline for. But the other risk that I would be more worried about, and what I've talked about earlier, would be airborne or aerosol. And it was a quite pleasant surprise. We didn't know that masks would help for airborne. We knew they would help a great deal for droplet, but we didn't know for airborne. But actually, a study came out showing that masks would reduce airborne transmission by 65%, which is way more than we expected. So the biggest concern that we would have if somebody was in this room without a mask is that it could travel the entire room. In fact, it most often would go travel on airstreams, so wherever your air outlet is, it will be heading to wherever the air return is. And so one of the things that I drive Mr. Heller nuts about is every classroom that I go to, I'm always determining where's the outflow and where's the return. And sometimes we find that a teacher has their desk under the air return. So one of the big things we do is we get those desks moved so they're not right in the line of fire. But it's a huge risk because now you have essentially no mitigation strategy. So it's whatever the risk is that person has COVID and is presumably asymptomatic, And that risk is going to depend on what are their associated behaviors. If they're not wearing a mask because they object to it on principle, which also means they're not complying with other public health guidance, it's a huge risk. If they're not wearing a mask because, as we've seen some cases where a child is severely disabled, that's going to be a lot less risk.
Thank you. And Mr. Chair, I'm not sure if this, Mr. Heller or a superintendent, we talked a little bit, and I just wanted to clarify, did we have a legal review of our entire plan, or did we just ask, how did that process work, if you could help with that?
Mr. Chairman and trustees, I don't believe we've had our legal review of the entire plan. We have asked specific questions along the way when there's been questions about certain pieces, but it's certainly something that we could engage our partners in legal counsel to have them review the plan in its entirety.
Trustee Klopfenstein, did you have any questions? I just have one, and I don't know, this might be more for Mr. Heller, but one thing that wasn't immediately clear when you read the plan is that this really is directed at the level of community transmission we have going on right now.
That's
and that
correct.
This isn't, you know, hopefully things are going to get better. And, you know, and you mentioned the fact that this can be revised, but obviously then there's some sort of process. You know, there's time lags everywhere. I mean, how does, and given that, you know, I mean, you worked really, really hard on this, took you a month, right?
Yes.
Right. And let's say we get 2-3 months down the road and, you know, we're back down at a lot lower cases per 100,000, and, you know, we're looking at being able to relax some things.
Mm-hmm.
But then we're going to have another month to review. You see where I'm going, Mr.
I do.
Heller, with
I do,
and
Mr.
procedure,
Chairman.
you know?
Let me put your mind at ease. It's a very good question. However, you know, just to kind of put things in perspective, I actually haven't looked in the last few days to see where we are, but we're somewhere in excess of 80 new daily cases per 100,000 right now. We have to cut that level about fourfold to get down to where the public health district would consider taking us to yellow. And so obviously we won't wait for that. When we see the levels going down, and it's going to take weeks once they even start going down, and I think we're a good ways away from them to start going down, but it is going to take quite a while. The changes that we're going to make to the plan are not huge, and really, if the superintendent still desires my services, it's something I could do in a day or two to make the changes for it, and we could get it to the board. What we just thought is that for right now, it really shortens the plan and creates a lot less confusion, especially if it's not going to be relevant, but we can do that very quickly for you.
Well, I mean, this is asking for a crystal ball, of course, but I mean, can you just give us some hint of what kind of changes would go on, for instance, or how the plan would be different for yellow?
So they're not going to be huge. Because really, the point where we can really change our behaviors is, you know, most of us imagine that you've got to get that number. I told you we're in excess of 80. Where it's going to really be safe to get to some sort of normalcy. Some people would say it's less than 3. Others would say it's less than 1. I mean, we're nowhere close. Now, what we can look at is if we can get the disease in the community, the spread down, even so we're not at those levels, and we can't give up things like masks and so forth. One of the things we think is possible is going to happen, and we're waiting, the CDC is reviewing this, is as we found, and in fact schools across the country have found, is that it does appear that schools that are very good about masking, which West Ada is doing remarkably well, at least in the schools I've seen, I mean way better than I thought, that we were reviewing the data, it's possible that we're going to get data back saying we can shorten that distancing. That would probably be the one big factor I think might be in play if we get the disease levels down to where perhaps they would revise. I doubt they will for high schools, but they might for elementary and middle. They might revise the distance levels down as long as people are wearing masks, and that could allow us to look at bringing more students back. I think that would be the biggest change. Most of the rest of this stuff, we're going to need masks through the rest of the school year. I just can't even imagine that that's not going to be the case. We're going to need hand sanitizing for the rest of the school year. I really think the one element that would be in question is perhaps we'll be able to let up on the distancing. Yeah.
Any trustees have anything else on this section before Dr. Pate moves on? Well,
thank you. Thank you, Mr. Chairman. As I move on with my report, I would like to take a minute just to reiterate that I have had a very positive relationship working with this administrative team. And of course, it may be of interest to this board how well we're working, whether they're receptive to my guidance and so forth. And I just want to reassure you, I work most closely with the superintendent, with Mr. Heller, with Ms. Garner, and Ms. Jackson. We meet, talk, and email frequently. I have found them to be passionate about their work and dedicated to education and well-being of the children while expressing great concern for the safety of our teachers. They have been very receptive and open to my advice. That doesn't mean they've taken every bit of advice I've given them, but we've had great discussions. They've certainly been open to it, and it's really been a pleasure getting to know these outstanding professionals. Now, after completing the pandemic operations plan, I was asked to propose criteria for the return of middle school students to full-time in-person classes. I have done that, and I believe you have those criteria before you. In fact, you probably have two sets of criteria. You probably have the criteria that I drafted, which list 5 criteria. And I believe you may have another version that is very similar to mine, but just has the first 3 criteria. And the reason for that was after I drafted the 5 criteria, that was sent for review by the COVID task force, and they reviewed it, and they made a recommendation to strike my numbers 4 and 5. And I just want to say, I wasn't at that meeting, so I didn't get to hear, but I have talked to Mr. Heller to understand what was going on. And apparently, it's not that we're in disagreement. I think it's a philosophical measure, a difference. They understand that this is going to be an evolving situation, and as you alluded to, Chairman Newhoff, you know, maybe in a month or two things are going to be better, maybe things are going to be different, and that certainly could be. They wanted to trim this down to kind of be almost like stages, like let's figure these 3 first, and if you meet that, then we'll look at the next criteria, which likely would be my number 4 and 5. My philosophy was, rather than doing that, tell you what I thought all the criteria would be now, with the understanding that certainly if things change and change for the better, I could come back to you and say, actually, I think we can loosen up those criteria. They don't have to be as strict. But I thought for now, the best thing was to tell you everything that for me would go into that decision. They're just taking the point of view of, let's just tell the board what we're sure is going to be the case for now, but likely if when that time came to consider, there would be additional criteria, if that makes sense. Currently, we cannot meet numbers 1 or 4 of my criteria. It is important to note that these are just my recommendations, and I haven't seen anybody else that's come up with recommendations like this. Actually, what I have seen is some schools, for example, if you look at New York City schools, they actually came up with criteria that didn't make sense, and that made a real problem there. These criteria, to me, make sense based on the approach we talked about back in October, where we don't want to be making our decisions based on community spread because there's not a great correlation. So we want to put those aside, and what I recommended at the October meeting to you is instead we should focus on what's actually happening in our schools with in-person transmission. So that's what these criteria are based on, and with that I'll pause my report to see, it sounds like some trustees will have some questions if you want to ask me about this before I go on.
Trustee Johnson?
Thank you, Mr. Chair. I have kind of 2 main questions, and I'm sure we'll probably all have some similar ones, but the first one is just really wanting to understand why behind these criteria. What does 4th and 5th grade have on impact on middle school? What does middle school have on impact? That kind of stuff. What are the whys behind the recommendation?
Good.
Just to get that.
Yeah, that's a great question. So the reason that I've made these criteria is there is a correlation. So for example, if we go back to October, at that point we were talking about K through 3 full-time in person, and then the question was, should we add 4 or 5? And you know, our view was that's going to be really difficult to distance, and of course the board's decision was to proceed. So we have. So given that the middle school classes more resemble the 4th and 5th grade sizes, one would first think that if we can't distance the students we currently have, then what would make us think that we could distance middle school when we bring back more students? I think the board at that October meeting was counting on we would find ways to do this, we would find ways to distance, and if we did that, then of course we could apply those same solutions to middle schools. But in fact, what we're finding right now is we can't distance the 4th and 5th. It's too many students per classroom. So we're doing the best we can. I've given recommendations how we could do even better, and we're looking at some of those things. But I don't think we want to bring back middle school students if we can't prove that we can do it in the 4th and 5th. The other reason is I think from a epidemiologic standpoint of this disease, we have to think about elementary school children are different from middle school, and middle school are different than high school, and in terms of their risk. High school students probably are twice as susceptible to infection as an elementary school child, and probably are as efficient in transmitting the virus as an adult. That's not true for elementary school students. Elementary school students are far less efficient. That doesn't mean they can't infect somebody, but so far, based on what we've seen, they're far less efficient at transmitting. Therefore, while we're having a pretty good experience so far. We're not having a whole lot of school transmission, certainly not consistent transmission or significant transmission. We are also likely benefiting from the fact that there are probably things we can get away with in elementary school we may not be able to get away with in more advanced age and more advanced schools. So that's why I premise opening middle schools based on can we do this successfully in elementary schools, because they're higher risk. And then can we base the decision about opening high schools on middle schools, because they're much higher risk. And I think if we can't do it in a lower level, then we're fooling ourselves to think we can do it in a higher level, and we will be taking much more risk. That's the first criteria. The second criteria is the indication that we have not only in-school transmission, but our operating plan has a huge hole in it. Something is wrong, and we would be, at that point, thinking about actually, closing schools down. And so if we can't do it in hybrid and we're having in-person spread, you certainly don't want to bring more students back. The third is, what I think of as clusters. Clusters are your early warning signs. And so if we see clusters, we know something's not right. Something is happening. We have a weakness in our program, or it's usually going to be something tied to, and most often it's extracurricular activities, but we'd want to look at what's going on there, understand that, and strengthen our operating plan to patch that hole before it becomes what I refer to in number 2 as a widespread spread. The fourth criteria I have is that and it goes back to a question you asked earlier about the risks of kids not having masks on, and I said one of our big risk areas, which involves every kid, is lunch and cafeterias. And so if we cannot successfully distance kids in middle school in hybrid, and particularly at meals, again, you wouldn't want to add more kids to that mix and make distancing even worse. And then number 5 of my criteria is merely that if we are at the point of thinking of bringing these students back, I would want to know that the principal has met with the teachers, understands, okay, what is the plan to now accommodate, you're accommodating the half students, okay, what's your plan for the rest? How are you going to do that and keep your distancing? And so that's the basis for these criteria.
Thank you. And Dr. Pate, you may or may not have known this, but we had asked today for the data on whether or not 4th and 5th had more positive cases than K through 3 in general. Looking at the initial data, I think, Mr. Heller, you confirm for me if I'm incorrect on this, but it doesn't look like there is a difference between the grade levels today in the
Doesn't
data.
appear so. Not based on what I've seen. But again, recognize, I think this is a combination of the fact we are doing really well in a couple things, which is getting kids to wear masks. Frankly, Superintendent, I'm just amazed at how well the schools are doing with masks. I think in one school that I visited, I think the most I found was 3 mask violations, which is incredibly good. And so I think we're doing really well in masks, and as I mentioned earlier, I think we're doing really well with the air ventilation. However, I don't doubt that we can throw in that we're also getting some good luck, because these kids in elementary school are less efficient at transmitting the virus, and they're less likely to get infected, and if they do get infected, they're less likely to transmit it. I think we've benefited from some good luck, but a lot of hard work and good practices. I worry that our luck might run out with older groups.
Okay. From a practicality standpoint, how does this actually get implemented? And that might be for Mr. Heller,
Yeah.
I don't know, but I'm just curious, how do we actually implement these recommendations?
So, Mr. Chairman, trustees, are you asking specifically the criteria, how are we implementing those criteria? So I think as we go through our process that we're doing quite often of identifying schools that maybe have an issue, and we're having those meetings and we're going through those things, one of the clearer lines is, are we having clusters? Are we having widespread outbreaks? Good news is we've been limited to clusters. We haven't had any widespread outbreaks to this point, but we're just monitoring that data at the 4th and 5th grade level. We're monitoring that data at all of our schools to kind of see how we're going. Our data dashboard, our COVID dashboard provides us with a lot of that good information. So we know kind of where we are right now as a district. We know the process we are in. I think as Dr. Pate said, we're going to start to see, we hope, that gets better over the next couple of months, and we're going to start to see things get better. And as that starts to get better, I think then we're going to really dial in on how close are we getting to being able to say, yes, we can do this, we can meet criteria number 1. Okay, so now where are we on criterias 2 and 3, and depending on board action tonight, we're to the point where, okay, we've met the criteria that we've said we needed to meet. Once we get to that point, what we've said is that's when we would bring team together and say, what's our next step to consider bringing middle school back to school full-time every day? And if the decision is, yep, that we've met the criteria and we believe we are now able to operationalize action to bring those students back to school daily, what's our timeline to communicate that to parents, to get that process started? And then as soon as that happens, then you're starting to monitor that data to look at meeting the criteria for high school students and starting to look like, how can we successfully bring our middle school students back, and are we doing that for 30 days without any of these issues? Are we seeing? So I think at this point we're not looking very closely at are we getting ready to meet these criteria, because we know without even having to really think about the data that we're not. We are regularly seeing cases. We are regularly seeing issues come up where we have a cluster that maybe requires us to shut a classroom and moving it to remote learning. That happens consistently still, and so we know based on just that bringing more students back isn't going to make our situation better in those buildings. So as things start to improve, as we start to see less and less of those situations with clusters, as our case counts start to drop, then I think that's where the opening becomes, let's start identifying how close are we to feeling comfortable with a transition for middle school and then to high school. So I hope that kind of answers your question.
It does, it's helpful. I think when I was looking at this, I was thinking about items 4 and 5, and the reality is that they could be implemented, they could be put together now and be ready to go for when the clusters and the case counts meet the criteria. If I understand that right, is that correct? I mean, those are not, items 4 and 5 in the list are not dependent upon cases and clusters. They're dependent upon school operations.
Yes, I would say that that's accurate in that those two are more related to our ability to physically distance and maintain operations. And I'll be honest, as the COVID task force discussed those today, one of the real conversations was 4 and 5, are we saying by having these two criteria that are a very high bar in terms of distancing, are we essentially communicating that we're never going to consider bringing middle school and high school back together? And that was a big part of the conversation today because, as Dr. Pate alluded to, in our middle schools last month, we've been spending a lot of time trying to find solutions to physical distancing, even on a hybrid schedule. There are still challenges that we cannot meet even on a hybrid schedule. We were supposed to go to Eagle High on Monday. All of us kind of forgot that Monday was a remote day and didn't make a lot of sense to do a walkthrough on a remote day. So rescheduling that for a day when there's actually students in the building, that's a school where some of the classrooms themselves are physically smaller than some of our other buildings. And so even greatly increases physical distancing challenges. So if we know we can't meet that now, even on a hybrid, are we ever going to be able to meet it on a daily schedule?
Okay, thank you. I want to communicate first, before I say this, that first of all, I really appreciate this plan. I love this way more than our former plan. I think
Thank you.
it puts it directionally puts us where I think we're trying to go, which is keeping as many kids in school as safely as possible. It's based on data, and it creates some flexibility and agility in our decision-making, which, pivoting 40,000 people to a remote versus pivoting 700 or 2,000 is a whole different
Yes.
animal operationally, and I appreciate that structure. I also appreciate the fact we took a stab at this criteria, because up until this point, we really didn't have anything to look at. So I wanted to say all that before I provide some thoughts on some feedback. The first thing is that one of the core components of our plan is that we create that agility and flexibility within the district. And I wonder if we can create that agility and flexibility at a middle school or a high school. So if a middle school can meet this criteria, they don't have any clusters, they don't have any outbreaks, can a middle school start to pivot? Could we consider that? That's one. And you don't have to answer that. I wanted to provide just more of a feedback, because I think that could take some thinking more than off the cuff, probably. The other is there isn't any criteria in here around the educational risk.
Mm-hmm.
So, and we talk about this, right? I know that's not Dr. Pate's area of expertise,
Right,
but
no.
I know that is, and I trust that capability and expertise at our superintendent and our staff's level. And I wondered if we should be looking at that at the same time as we are looking at the safety risk to balance the two, because if we are losing our kids while keeping them safe, I don't know if I guess I'm just worried about that. So those are my two feedback items.
Trustee, I know you weren't looking for a response, but I think those are both really good points. The first one, I think it's really consistent with the approach we're already taking, because if you recall the October meeting, one of the things that I talked with the team about is, because I understand everybody would like to know, just tell me the number. If we hit this number, then we know we're going remote. And we had a long discussion about that. And I pushed back, is that really what you want to do? Because if you're not seeing in-school transmission, or if you have one school that's very problematic, do you really want to shut down all of them? Or if the problem is just in high schools, do we really want to close elementary schools? And it seems like our approach should be targeted, and I think obviously we all agreed, and that's why we came up with these criteria. Really what you're suggesting is the converse, is instead of looking at an approach to open all the middle schools at one time, and I don't know the answer to this, but perhaps there are some schools that maybe are newer, do have bigger classrooms, maybe this is more achievable. I would, from a medical standpoint, I would have no objection to that. I'd have to talk with the superintendent and the assistant superintendent to know, does that create the educational issues? Because as you said, I'm not an expert in that. But from a medical standpoint, that would be very consistent with our approach. As to your second point, I do want to reassure the board, I certainly have tried to make it very clear that I'm not an expert in education. I am not knowledgeable about all the other associated issues, food security, domestic violence, other things that might play roles in the decision making. I'm not equipped. That's why a board or the superintendent should be making that decision, not me. And I'm pretty clear to make sure that I communicate that whatever your decision is or the superintendent's decision is, I'm just going to try to tell you how can you do that in the safest possible way. So, and I will tell you, and it it goes back to my earlier comments about this team. One of the things that I have loved is I've watched them struggle, visibly struggle with this balance that you're talking about. I think they're acutely aware of there are other risks besides just medical. I can't help them with that, but I can help them with the medical piece, but I know they're wrestling with all those things.
Any other trustees? Trustee Azuna?
Thanks. I want to step back to something that Mr. Heller was talking about related to the physical distancing with middle and high school. And I just want to have a really open and honest conversation about where we're at and where we're going, because even scratching 4 and 5, because they look like it's not very realistic for us to open with 4 and 5 in place, or specifically the one related to distancing. I think item number 1 on the criteria also is going to be very difficult for us to get through, right? I mean, we have a problem with physical distancing for grades 4 and 5. And I think we owe it to our parents and our community to be honest. If our intention is to make sure that we can physically distance kids in middle school and high school to be open, then we're probably not going to open this year. I mean, that's just the reality. If we're going to take some risks, maybe if our community spread goes lower or whatever the criteria might be, but if we're willing to take some risks, we also need to be really honest about that as well, because there are some families that might need to move to the virtual schoolhouse, which our enrollment for that just closed. So our timing on this is a little unfortunate as well, but what I want to really know is realistically, are we going to be able to move middle and high school back to the classroom every day this school year, or are we not? Is community spread, and if those numbers go down, is that going to allow us to revisit the physical distancing? Or if we get a change with CDC, will that make some changes? You talked about mostly with elementary school, and it might not impact middle and high school, but I really want to understand that better and where we're going.
So, Trustee Ozuna, it's difficult for me to predict. Unfortunately, right now, the picture's not good. In fact, I will not be surprised if we look back a month from now and think these were the good old days. I think that it's going to get way worse. I could be wrong. And frankly, I think that one benefit of, and this is really hard for me to say as a physician, but one benefit of the skyrocketing cases is for those people that didn't think COVID was a thing, we are increasing the number of people that have either been personally affected or had a family member or somebody affected, and it might change their thinking about this. The other thing is, I think we are dangerously, dangerously close to overwhelming the hospitals and crisis standards of care, and I think the public has no idea what that means or what that's going to be like. And when we do that, I think they're going to be shocked, and that may shock them into better compliance. There's other variables. The vaccine is coming. We're about a week from the first doses. Now, it turns out we're getting less vaccine than we thought, but we're also probably going to get more vaccines approved than we thought. And so, things could change in terms of how soon do we get that, how much do we get that, how willing are Idahoans to get immunized. That would be a game changer, but I don't know the answers to that. And so right now, if you were just asking me, look in my crystal ball, do I think it's going to be safe to have middle school back full in person and high school back full in person this school year? I'd be really surprised. I'd be thrilled. And I want to make it clear, my objective, our shared objective, is I want to find ways to facilitate every kid being in person who parents want them to be in person, as long as we can make it safe. My objective is not to try to keep kids in remote. That's not my objective. I understand it's better in person. I'm just trying to figure out when can we do that safely, and that's tough. So no, my prediction would be it won't happen this school year, but I wouldn't rule out that it couldn't happen this school year. But I do think things are going to get much worse before they get better. And again, one of the tough parts was, if all students were the same from a medical and epidemiological standpoint, we could conclude at this point, we might as well bring the middle school back and the high schoolers back, because we brought 4th and 5th grade back and we're not able to distance them either, so let's just bring them back. The problem is, if we go based on the available science to date, we don't think that they are equivalent. We think the risks are much greater as you get older. That break in the age appears to be around 10 to 12. So you're talking about the end of elementary school is when they go up in the category. But you know, the big risks start where they become essentially as equivalently effective and efficient in transmitting is about age 15. So our high schools are the highest risk as far as we know today.
Can I ask a follow-up? And this is probably specific to those high school kids then that are more spreaders. We know that kids have some lower risk if they were to contact the virus.
Yes.
So is the real concern, since we're able to safely distance teachers, I'm assuming we have that worked out and we have ways to safely distance the teachers, is the concern then that we could have the asymptomatic high school carriers in that case that are then contributing to the community spread, and that's where the risk is at? Because there would be some that say, you know, these kids are lower risk, and if the parents choose to send their kids, they themselves have a lower risk if we can protect the teachers.
Right. And, you know, Trustee Ozuna, this gets to a great point, because people have often told me along the course of this pandemic, look, we know who's at high risk. Let's keep them at home, let's keep them safe, and let everybody else kind of go along the way. And the problem is, we have demonstrated repeatedly over and over again that line of thinking does not work. And the reason that we would be really worried, and let me focus on the high school students, because of the fact that we think they are just as efficient as at transmitting the disease as adults. What we would be concerned about is most of our spread occurs within families. And we would be worried about multi-generational homes. We would be worried about high-risk individuals at home. And I think it's also important to understand, and this is a problem with our messaging, we've talked about high risk, and so people have kind of assumed, well, if you're not in the high risk, then you're in a low risk. When we say high risk, we mean high risk of death. We do not mean high risk as to whether you end up in the hospital but survive, or whether you get infected and you survive but you now have long haulers disease. We don't know how to pick those people out that are going to have long-term problems. We also don't have any idea how to predict which children, even younger children, who get sick will end up with the complication we refer to as MIS-C, which is going to put them in the hospital and make them very seriously ill, although they usually survive. We can't pick those kids out. We don't know what's different about them to identify them. So the big risk is that they're going to have infection and they're going to spread it to higher risk people, not the risk to them themselves, although they would be at risk, but it's really the higher risk people that they're going to transmit this and perpetuate the community spread. What has been really good about our school experience so far is most of the time in the traditional school settings, we seem to be successful at those kids coming to school infected somewhere else, but coming into school with the infection and not spreading it. Of course, our challenges are if you take those kids and you put them on a school bus, if you take those kids and they carpool somewhere, if you take those kids and they go out somewhere after school, those are some of the big risks. But it's not happening in our schools to any significant extent.
Thank you, Dr. Pate. Mr. Chairman, I have one additional question. I think it's for Mr. Heller. Mr. Heller, through this, one of the things that I don't think we've done a very good job of is communicating the operational impact to our parents. And we see some of the numbers, or I guess it's even on the dashboard, related to how many students, student cases we have, or how many absences, I think, for students maybe are out. I forget exactly what's shown. But I know that we have a pretty serious issue with getting substitutes, and we have a lot of staff that are out. I'm assuming it's not just teachers, but it's all staff, and there's operational issues. If we were to put middle school and high school back to return all day, every day, what does that translate to? And I know we're doing a guess here, but related to absences and eventually which would just shut us down to a fully remote. Because that's one of my biggest concerns, and on top of the health related issues, the safety issues, but one of my big concerns is a return for middle school and high school that lead to massive amounts of student and staff absences, which would result in us moving to fully remote.
Mr. Chairman and trustees, I can tell you that with middle school and high school as it is on a hybrid schedule, that is presenting a challenge for our buildings every day. The operational sustainability is kind of what we talk a lot about, is the constant work that's happening for contact tracing. And we talked about this quite a while back, that as we've researched other districts, large districts like ourselves who did return to full-time in-person instruction for their secondary students, the biggest challenge they ran into was the mass number of students they were sending home on quarantine because of close contacts. We have seen that in action on a hybrid schedule, that we are sending home large numbers of students because of close contacts. Bring all of them back, you're going to increase that number of students that you're sending home. So there's an educational disruption that starts to happen as students are moving in and out of quarantine all the time. That disruption is hard on the students, no doubt. It's also extremely difficult and hard on our teachers, and then our administrative staff and nursing staff that are doing that contact tracing work. It's a heavy load that they are working on, in addition to all their other duties of their job that they're already doing. And to bring all of them back is going to increase that burden. We see a large number of teachers out for whether it be close contacts. That's a good number of our sub situations we have, is teachers who end up being a close contact of someone else, and they now have to go home for quarantine. And it's causing an overburdening of our sub pool that we already have. Again, it's only a guess. Bringing all of them back is going to increase that burden in terms of subs, and we are likely going to have situations where we have to transition whole buildings to remote learning purely because of operational sustainability. Boise School District, much of what they talked about when they made that transition as a district was that operational sustainability. We have said we're going to do that school by school. It has typically been the reason why we get close to moving a whole school to remote, is that operational piece, not necessarily because we're seeing a spread of COVID cases causing us to have a risk. It's really, do we have the subs? Can we provide the adequate supervision? Can we do all of the things we need to do to keep that school running? So I can only assume that if we made the move to full-time, we would see what the other districts who've done that have done, where they've started to see that becomes an overwhelming piece that they can't keep up with.
Thank you for covering that, Mr. Heller. I do think that it would be helpful for our community to understand that when we have the opportunity to share that information. I should probably correct, I think I said that we were able to safely distance our teachers too, and I know that that's not always the case in every scenario, and there are teachers that are close contacts. So I just want to give that correction too. Thank you.
Trustee Buffy?
I have a follow-up question for Dr. Pate regarding vaccines. Understanding that adults in the schools are able to socially distance, and they are the ones that the vaccine will be available for, I'm wondering what your expectations of the benefits will be to our schools and our students.
Yeah. So I think there's going to be tremendous benefits. The first one is going to be, certainly as Mr. Heller was just talking about, we don't just see infections in students, we see them in teachers too. And it's the same thing in healthcare and other things. When the community spread goes up, we see people of all professions getting infected as well. And so the first thing the vaccine will do is help protect our staff and make sure that we're not having as many absences, we're not having as many infections. So that's the first thing. The vaccines is a matter of practice. We usually don't give a brand new experimental vaccine to young children in the initial trials. But given where we are with the safety and efficacy in adults, and most of these studies have looked at kids 15 and above for the trials. But given that they have been so safe so far, I do expect very soon, with the FDA's anticipated authorization of these vaccines, that they will quickly start trials in young children. And those will not take as long because we don't have to do everything that we did for adults. We just got to show that we can figure out what's the right dose for them and do they have the same response and is it safe. I am certainly hopeful that that vaccine will be available for children by the beginning of summer. And I think it may make it harder for us because we're probably going to have to do a lot of outreach over the summer to encourage parents, get your children, vaccinated and all, because if we do, and if we can get a substantial number of our staff vaccinated and a substantial number of our children vaccinated, we can begin to think about much less restrictive practices next school year. So I'm currently optimistic. A lot of variables. How much the vaccine impacts things, I really think of three things. How much vaccine does our state get? How many people will get vaccinated? And how soon can we get that approval for kids? But I'm actually pretty optimistic about all three. Thank you. And congratulations on your election to the board.
Trustee Klopfenstein, do you have anything? My questions were asked. Okay, great, thank you. Well, Dr. Pate, you had more?
I do. With the completion of the rewrite of the plan, the administrative team was eager for me to begin walkthroughs of schools. And I want you to know this is another thing that you can be very proud about, the progress your administrative team and I have made. To my knowledge, this is a best practice that no other school district in Idaho does, but we are anxious to share this practice with them so that they can implement it. And in fact, I am not aware of another school district in the country that does this. And I know recently I was on a call to healthcare leaders across the country who have been asked to help their schools, and no one had heard of this practice. They were all anxious to adopt it. So I just want to commend West Ada for being so progressive. I also want to take this opportunity to recognize Christy Allen and Haley Cervenka from Central District Health, who have partnered with me in all of this work. They have been incredibly generous with their time, feedback, ideas, and joining me for the walkthroughs. In fact, they have been very excited to share what we have created at West Ada as best practices with the other public health districts across the state. So under the direction of the superintendent and Mr. Heller, we created our process for the walkthroughs. Christy, Haley, and I created a walkthrough process document that can be used to train others how to conduct walkthroughs, and we're approaching that point now where we are looking to train others to do this and phase down what I'm doing and empower them to do these, and a form that they can use to document the findings of the walkthroughs. So far, we have conducted 4 walkthroughs, 2 elementary schools, 1 middle school, and 1 high school. And we did that in the week before Thanksgiving and the week after school reopening following Thanksgiving. And I allowed administration to pick the first 2 schools, and then Christy, Haley, and I picked the last 2. And here's what we've observed so far. Number one, everyone is taking this seriously and trying to do the best they can. I've been very impressed with the local school leaderships, how dedicated and committed they seem to be to this. Secondly, school leaders, staff, and teachers are doing a fabulous job at keeping the kids masked with proper masks worn properly. The one exception that we didn't actually see, but some teachers told us about, is on occasion, children will come in with an adult mask that's too big for their face and it's sliding down. And so Mr. Heller and I have talked about the need to get the message out to teachers. We do have child-sized masks if any of the children are having that problem. We've got them at the schools, and how they can easily get that. I have been very pleased that there is an ample supply of hand sanitizers in the right locations, and to my surprise, I have not found one that is empty. And let me tell you, that doesn't happen when I go to the hospitals. I try all the hand sanitizers to make sure staff is keeping them full, and the school's doing a fantastic job. Fourth, the special education certainly has its challenges, but again, it's doing far better than what I expected to see, and that's a real commendation to those very special teachers. I have also been pleasantly surprised by the efforts made by choir, band, and PE teachers to modify their usual practices to be safer. These activities all have special risks that we don't ordinarily experience in traditional classrooms, and it appears that these teachers are very knowledgeable about those risks and have instituted very good measures to mitigate those risks. So I'm extremely pleased and surprised that they have done that. Finally, also surprisingly to me, but a huge testimony to the superintendent and her team's messaging across the district, I have not seen one improper use of a face shield. And you may remember in October, that had me quite agitated and huge risk. And I think the team has responded quickly and decisively, and we have straightened that out, and that's fantastic. It is no secret that I am very scared about the level of community spread that we are experiencing and the threat that this poses to hospitals and healthcare workers. In talking with the administrative team, I have used the analogy that our schools are fortresses, and constant attempts are being made to cross the moats and penetrate the walls of our fortresses. We must constantly be on the lookout for penetrations and, even worse, crumbling of our walls or holes in them. So continuing with my fortress analogy, what are the greatest threats that we've seen in our schools so far? Number one, school buses. We have not been able to actually see these in action, but I've certainly talked to others, and we're certainly told that there are cases in which the buses are packed, and sometimes with 2 to 3 students per bench. So that's worrisome. The second, we've already talked about distancing. It is quite clear to me that the vulnerability created by the fact that we can't distance successfully has been mitigated by our outstanding compliance with masks. Obviously, our luck may run out at some point, but so far so good. But this is also the biggest reason why we simply cannot bring back more students for in-person education at this time. The third risk point is lunch and cafeterias. While every school that I have visited has done a very good job of spacing students out for lunch from side to side, we also see that in every school, the same is not true about the children sitting across. They stagger them also they space them also 6 feet, but then stagger them, which means that you're 6 feet this way, but you're 3 feet this way. And so we've pointed that out to the schools. We've discussed options for addressing that. That's obviously a risk, especially because they take off their masks to eat or drink. Fourth is our school nurses. These are phenomenal, dedicated, and extremely caring professionals who I fear cannot sustain the huge number of hours it's taking for them to do their jobs due to the combination of normal nursing duties, the need to see and evaluate students with illness, and the contact tracing duties. On top of that, many parents not having any alternative reliable sources for general information on COVID are utilizing the nurses to provide answers to questions about COVID, dealing with issues and circumstances that are outside of school, and they feel compelled to respond. So possible additional measures to contemplate, and Mr. Heller and the team and I are working on some of these. In some classrooms, distancing has been compromised by the need for desks to be moved closer to the front and or center of the classroom to allow students to see the board or screen the teacher is using. So one thing Mr. Heller and I have talked about is, could we get more screens in the classroom so we can get those desks spread back out, but allow that visibility. The other possibility is, just as we talked about in special ed, could some of the students that have to sit back further, that won't have great visibility, is there some way to use our current Teams or other technology to be able to just look at it from their desks? Lunch and cafeterias, we have asked the principals to reconsider their configurations for seating in the cafeteria to make sure it's 6 feet in all directions. In many cases, this may mean sacrificing their efforts at cohorting. One thing that we see, and this is really good, that their effort is to try to keep students from the same classes together, but sometimes that results in not using all the available space. So we have suggested to them that while I applaud those efforts to cohort, it'd actually be better just spread them out. Also we're looking at other alternatives. One school used dots in their hallway to have children come out and sit in the hallway to eat. We've also seen another school convert part of the gymnasium to additional lunch seating. So we're exploring those options. With respect to school nurses, I have contacted all the area nursing schools to see if nursing students might be willing to volunteer some of their time to assist school nurses with contact tracing, and we have received some offers of assistance. I have also checked with the state to see what West Ada could do with respect to utilizing the National Guard. And I was told that if we want that option, we can avail ourselves of it. We would simply make our request through Central District Health. So I have let Ms. Garner know about that, and we're looking at that possibility. I've also offered to reach out to the local medical school to see if we could get some of the medical students to volunteer to assist. And then finally, one of the other things Ms. Garner and I have discussed is it may be that we need to set up a call center, and that we could do that to handle a lot of the things that don't require the school nurse's specific time, that we could answer and free them up a little bit. And especially what we find is the school nurses are just, they're working late in the night because they're very concerned that a parent's going to send them a question about their kid being sick, and should they come to school the next day, and if they miss that, the parents will just send the kids. So they're working all these hours. So we'll see what we can do to help them. It appears that winter sports are almost certain to proceed. After speaking to 2 West Ada High School basketball coaches, I certainly feel much more confident about basketball, and I think they've got some really good plans, and I am just really impressed by these coaches. I have also worried, are these 2 exceptions to the rule, but they assure me they believe all the high school coaches are taking this very seriously. However, I do remain concerned about wrestling. I'm not saying we shouldn't do it, but wrestling is much riskier than basketball in many ways. So one consideration would be whether we should implement 3 times testing every week for wrestling athletes because of their extraordinarily high risk. But they have relatively low numbers of wrestlers, and so this may not be logistically that difficult. And I believe that we could come up with a lower cost solution. I've had some discussions with Crush the Curve about options, and one of the things that we talked about is perhaps what we could do is do pool testing, which means in wrestling, the wrestling coaches are already creating kind of their version of pods, and they're doing it by weight group, and typically just several wrestling students, and they will always be in the same group wrestling each other through the season and not the others, and therefore if there's a problem, they just quarantine or isolate those students. But we could test them as a pod, and that's 1 test instead of 3, and so it'll be cheaper, because if it's negative, then they're all negative. Problem is, if it's positive, we don't know if 1, 2, or 3 of them are positive, but we can handle that. But that is an option we're exploring. And of course, it would be more productive if we could actually talk the whole conference into adopting that. So let me once again pause my report. I'm almost finished, but see if any of the trustees have any questions about the walkthroughs and my findings. And again, I just want to commend the superintendent and her team. I think between this operating plan and our walkthroughs, I mean, you've got a best-in-class program right now.
Any questions or comments from trustees on this section? I'll see, so proceed, sir.
Well, in closing, and I know you're happy about that, I want to thank the superintendent for this opportunity to partner with you to try to enhance the already great work being done at West Ada in an attempt to continue to operate our schools safely and protect leaders, staff, teachers, students, and their families, especially as we prepare for levels of community spread that are beyond even what I feared earlier in the year. My requests of the board are, and number 1, please don't bring back any more students back at this time, full-time, in-person learning. While we are currently doing it in the elementary schools, we are not able to do it in an optimized way, and we likely can get away with that in elementary schools, but each successive grade level and age group, the risks go up and likely significant. The second thing is, to the extent that administration determines that recommendations that I have made to further improve safety of our schools require additional funding to implement, I hope you would entertain those requests. Third, similarly, we must support the school nurses. Frankly, they are likely the linchpin to keeping our schools open. Their work to date has been heroic and inspiring, but I am convinced that it is not sustainable. While the majority of solutions I have proposed come at no additional cost, it is possible that a call center might involve some costs, and I hope you will entertain that consideration if we determine that is the best approach. I have also reached out to the Idaho Department of Health and Welfare to request that the vaccine committee for the state consider the inclusion of our school nurses in the first group, the so-called Tier 1A, and they are considering my request. Our nurses are evaluating students and teachers with illness, conducting our contact tracing, and we could suffer significant disruption to our operations if these professionals were to become ill. My last request is a delicate one. Fortunately for me, I feel completely free to be honest with you because my being fired would only end up putting me in better graces with my wife. I have the utmost respect for the responsibilities of this board and your elected positions. I also have tremendous respect for your superintendent and her team, and they have earned that. I have high standards, I am demanding, I am critical, and yet this team has responded well and is deserving of my trust and confidence, and I believe they deserve yours as well. I ask you that you trust and support the recommendations and decisions that they make. That doesn't mean that they should not be questioned or be held accountable, but I do think they deserve your deference. I want to commend the board and the team. While there was a period of time where there was a great deal of tension and conflict between the medical and public health advice and the concerns of educators and school boards, this did not have to be, and I applaud the superintendent for asking that medical professionals work together with the educators to navigate through this public health crisis. This has been a very successful model at West Ada. This board, the superintendent and her team, continue to make the decisions. However, now medical professionals have a seat at the table to understand the direction that you all have decided to go and to help you in doing that in the safest fashion possible. It has paid off. While all the surrounding school districts have had to go remote until sometime next month, we have been able to continue to achieve our goal of providing in-person education for parents of teachers, or for parents of children who wish to have them have that opportunity. We don't promise that we can continue to achieve that goal, but we have had great success in keeping our schools relatively safe with few clusters and no outbreaks. Hopefully, we have achieved the best balance possible under these most difficult of circumstances of keeping our teachers, staff, students, and their families safe while meeting the educational, social, and emotional needs of children that we are privileged to serve and educate. It is not the level that any of us would want under normal circumstances, but we may be accomplishing it better than most during this time of an unprecedented pandemic. That completes my report, and at this time, I will take any questions that you have, and thank you to the board.
Thank you, Dr. Pate. Is there anything else from trustees? Trustee Johnson.
Thank you. Trustee Ozuna prompted my question. It probably should have came earlier, Dr. Pate. But
Sure.
We were actually discussing the definition of a cluster.
Yeah.
And we both read that a little bit differently.
Okay.
So could you clarify the definition of a cluster for us?
So a cluster is an association of cases both temporally and physically. In other words, what we're looking at is, for example, if 3 cheerleaders got infected the same week after, having cheerleading activities in the same week, and they have that association with being together, that's a cluster. Now, that may or may not be in-school transmission, because what can happen is it could be those 3 cheerleaders are also friends, and they're having sleepovers and having a problem where they're getting together and not wearing masks or something. But we need to look at that and determine that would be suspicious. Or if we had several children in the same classroom show up infected at relatively the same time. Again, wouldn't necessarily mean it was in the class, but we got to look hard to make sure it's not. That would be our first clue to a possible in-school transmission. But clusters are really related to each other, as opposed to outbreaks, which it just happens. It's not just the cheerleaders. It's not just one classroom. We're seeing this a significant spread throughout the school. That would be the outbreak.
Thank you. I think if I understand it right, if two or more
Yes,
can be connected,
that's right.
and the cases are positive and the cases can be connected, then it's a cluster. But you could have 2 students in a classroom who are not connected, who have positive cases. That is not a cluster.
Yeah, so it has to be time. And so, in other words, someone infected in the class last month and somebody infected tomorrow, that's not a cluster. So it has to be both in a time period where we think they may have a common source of infection, and some kind of relationship that put them both in contact with somebody where they could have been infected. Again, that may or may not have been in the school, but that's what raises our alarm, and we would look to see if it was something outside of school or whether we believe it's in school. So yes, it's two or more, and we also qualify it's not from the same family, because we know there's a lot of transmission in families. So if you have two sisters and they're both on the cheerleading team and they're the only ones infected, that's not going to be nearly as concerning to us as people from different families and households.
Okay. Thank you, Mr. Chair. And I think the last question is maybe more for you than for anybody else. We talked a lot tonight as we asked questions of Dr. Pate and Mr. Heller around some potential things like legal review or looking at the criteria. We know that CDC just came out with some new guidelines around the quarantine period changing from 14 days to 10 days, these kind of change and updates. And I guess, and maybe it's a discussion as a board, I don't know, but we've done this before where we've approved a plan and then we've had to come back with multiple changes. And that gets confusing from a communication standpoint when it comes to outside of all of us who work in it more constantly. So I wanted to talk through kind of what folks were thinking from the standpoint of changes and updates and how we approach that so that we can create some clarity and not have multiple changes. And maybe there is some administration feedback in there too. I hate to have onesie-twosie updates every board meeting if we can avoid it. So.
And Trustee Johnson, if I might offer a potential, one thing you could consider as a board is if administration wants to make a non-substantive change, it's not material, that they be authorized to do so. And if they want to make a change that actually makes things less restrictive, that is consistent with the CDC and the Public Health District Board, I can't imagine that you would all object to that, and maybe you authorize them to do that, whereas had the CDC said, we need to quarantine everybody a month, then you would still require administration to come back to you. But maybe giving them the leeway for something that's clerical or not substantive, and for something that is less restrictive as long as it's consistent with the advice they're getting from Central District Health and the CDC. That's just a suggestion.
Dr. Pate, thank you very much for the time that you spent on this and your willingness to help us, because I think that it's been really, really beneficial.
Oh, thank you.
One question that I had for Dr. Heller, I didn't have time to go through sorry, not Dr. Mr. Heller. Okay, for tonight. But there's another section that got added to the plan today, and I didn't have a chance to go through it. And so I guess adding on to what Trustee Johnson said, I don't have concerns about the plan. The last thing that I want is for the public to think that we would be opening this up for a whole bunch of changes. But I would appreciate some time to go through that section, or for us to go through that section in detail, because I just didn't have time to go through it. And I would also really appreciate some feedback from legal related to the mask exemption section. So I don't know if it would make sense for us to maybe schedule another meeting and come back, or take time to go through some of these things now.
Well, Mr. Chairman, trustees, I would certainly defer to the board and your decision on that. In terms of the section that we added later this afternoon, I think I sent it to you guys at 1 o'clock. It was based on some feedback received from some trustees wanting maybe a little bit more of a linear identification of the process we use when we're having those meetings. I think everything that's in there exists in the plan, but it's not necessarily as here's step 1, step 2, step 3, which is how I tried to present it in the additional pieces that I added. But I understand that you received that at 1 o'clock via email, and you all have lives and work outside of your duties here. And so, if this board chose to postpone or table this for an additional meeting, that's, again, a board's decision, and I would I'll be here. I'll be here at the next meeting as well. So whatever we need to do there, in terms of legal review, that's certainly something we can continue to pursue, to have them review the entire plan in detail if that's, again, something the board would desire.
Mr. Chair, I also echo Trustee Ozuna's concerns on those two, just having that time.
Is there anything else? Well, thank you, gentlemen. We have a few patrons who want to testify. Clerk Newbold, how are we going to handle this? We're going to have at least one person leave the room. And somebody, I guess, escorting them.
Chairman, if you could read the name, Mr. Gillen will bring that person over.
Okay.
If that's
great.
okay.
Thank you.
And I can also leave the room if you need. I'm glad to leave the room.
Thank you, Dr. Page.
Thank you.
Thank you.
All right. The first person is Lindsay Heiner. What? And the next name is Abby Hawks. Well, you know, it's caught my double entendre there. Okay, so while you're making your way, Ms. Heiner, when you get up to speak, please say your name and your address. There's a 3-minute timer, and I ask you to stay within that. The board won't ask you questions or interact. Just provide your testimony.
Thank you.
Turn.
I appreciate that. My name is Lindsay Heiner. My address is 1778 East Dunwoody Court in Meridian. Thank you. I appreciate the opportunity. I wanted to speak to Trustee Buffy and say, I appreciate you advocating for West Ada kids. I appreciate you coming forward at a time when we know it's going to be difficult. We're in a pandemic, so I appreciate that. And this year, 2020, marks the 100 years of the women's right to vote. And I just really believe that the more perspectives that we have on such important issues that our community is facing, the better. So we just heard for close to 1 hour and 45 minutes, 2 hours, one perspective on this issue. And we would ask, where is the representation from the perspective of mental health professionals? Where is the perspective of parents? Where is the perspective of students? What about in an open meeting? We allot that same amount of time, 1 hour and 45 minutes, to students and hear their perspective. Just like Trustee Johnson said, are we losing our kids? Let's talk to the kids. Let's hear from them. As parents, our belief is that students should be able to go to school. It's really important for students to be able to go to school, and it is possible. There's a body of articles that have come out in the last couple months. We know more now than we did before that say kids should be able to be in school. It's coming from Dr. Fauci, it's coming from our governor, it's coming from so many different perspectives. So it is possible, and we want you to ask hard questions. We want you to explore options. We want you to provide leadership all with this working narrative that it is possible. It's possible. We turn to you for leadership. It's your turn to provide some representation to parents and to constituents. The education gap is growing. Just yesterday, a McKinsey study came out showing the disparity between those that have the resources and those that don't, and how far they're falling behind in their education. Let's stand up. Let's stand up for all kids. It is possible. You're an advocate. I know you are. I'm an advocate. Parents out there all over the district are advocates. You all are. Let's advocate for the kids. Let's advocate for kids to be able to go to school. Thank you. Appreciate it.
Thank you, Ms. Heiner. And Tyler Hurst would be on deck. Trustee Newbold. Ms. Hawks, as you make your way, please state your name and your address when you begin, and you have 3 minutes. Mr. Stevens will have a timer up on the board.
Okay. My name is Abby Hawks, and I live at 6828 North Sunset Maple Way in Meridian. I have a middle schooler and a high schooler. Good evening, trustees and Dr. Reynolds. One of the things that is most discouraging, as I've watched so many hours of these meetings, is the amount of time that is spent on trying to control a virus, and very little time on the education and overall well-being of our students. None of us knew back in September how a hybrid model would work, but now we know. Just like 70% of the students in my high school son's English class, it is failing. Teachers aren't happy, and they are complaining about how they dislike the hybrid model to their students. Parents aren't happy as they try and juggle upended schedules with their kids, only to go to school twice a week. The technology isn't working. Most importantly, the students aren't happy as they struggle to learn in an environment that has offered them less than 30 personal school days since March. Now that we are in mid-December, there have been volumes of data released on how kids are much more likely to contract COVID outside of school than inside of school. We know many kids don't have dependable Wi-Fi and devices, or their parents are not available to tutor them through the screen time through the school day. We know grades are in a free fall, and the long-term economic impact to these kids will be catastrophic. I never thought that Meridian would be a place where bars are open every day and our kids are only in school 2 days a week. Somehow we have found a way for restaurants and retailers and bars and offices to be open, but we deem schools 40% essential. That should not be the priority of this school board, and it does not reflect the values of this community or the wishes of the majority of the parents of the district. It is time to fix this for second semester. Give every student and teacher a choice. Online every day or in person every day. Those that want to teach and learn online can make that decision, but those that want to teach and attend in person can do so safely right now. As has been proven in many districts who have already been doing it, and they should not be forced into an outcome of failure and disadvantage, especially for those kids that can least afford it. The answer to improve kids' mental health, physical health, social and economic health is all the same. Open the schools. And I want to thank Trustee Johnson for her comments and questions about the mental health needs of our grades 6 through 12. They are not okay. They're not. Thank you.
Thank you, Ms. Hawks. Clerk Newbold, Jamie Thompson will be on deck. Mr. Hurst, as you make your way, when you begin your testimony, please state your name and your address, and there'll be a 3-minute timer for you, sir.
Okay. Tyler Hurst, 9982 West Golden Rain Street, Star, Idaho, 83669. Trustees and Chairman Newhoff, thank you for the time. While the district has been taking the time to find the best way to educate in this pandemic, there are a whole swath of students that are being forgotten and left behind. There's been aspects of student life that have not been addressed. As the superintendent of the Atlanta School District recently said, we're losing them. Over the past 10 days, there's been some stories from major news outlets, including the Washington Post and the New York Times, highlighting some of this. There are real tangible facts that explaining how shutdowns are deeply harming students. In Maryland, failure rates in math and English jumped as much as 6-fold and much higher among vulnerable students in some counties. Students across the greater Houston area, metropolitan area, got Fs at an unprecedented rates. With districts reopening, nearly half of the middle and high school students failing at least one class. In North Carolina, 46% of students in grades 3 through 12 in Wilson County failed at least one class. In Fairfax County, the largest school district in Virginia, the largest district in the state, reported that among children 11 to 18, there had been an 83% jump in students with 2 or more F grades. I'm, of course, curious about the similar learning data in West Ada. Maybe the worst part, though, is the intangibles. The students in the shadows and that have been forgotten. The discouraged and the disheartened. The hungry and the helpless. The alone and the afraid. What is being said of them? Who's protecting them? Who's thinking of them? As Dr. Pate brought to our attention tonight, there's many, many, many issues besides just the education of students that we need to be paying attention to. Our first duty has to be to stand for all students' welfare. It's happening here in West Ada, and we need to take into account the emotional, social, and mental well-being of our students. A recent study of 3,300 high school students found that nearly 1/3 reported feeling unhappy or depressed in recent months. In the same article, here are the words of a student. Here's the words of a student. There is nothing to look forward to. On virtual days, I sit from a computer for 3 hours, eat lunch, walk around a bit, and then sit for 3 more hours, and that's my day. It's just a cycle. Not only are we causing unneeded stress and anxiety among kids because of the new normal of failing grades, but overwhelming evidence of increased depression and anxiety. According to the CDC, compared with 2019, the mental health-related visits for children ages 5 through 11 and 12 through 17 have increased 24% and 31% respectively. Again, from the New York Times, the social isolation of a pandemic has taken a toll on the mental health of Americans, but the impact has been especially severe on teenagers who rely on their friends to navigate the maze and the pressures of high school life. As I finish, take into account that many districts around the state and the country have found a way to return kids to school safely full-time. Let's do it. Let's take the marginal risk with the 74% of parents who want to do it, and let's get our kids back in school. We're West Ada. We are the most prolific school district in the state. We strive to innovate. We reach for the stars, and we are the very best. It's time to lead. West Ada can do it. We've always done it. So let's take the steps necessary to lead and put our kids back into school. Thank you very much.
Thank you, Mr. Hurst. Sheila Benson will be on deck. Ms. Thompson, as you make your way, no, please. I was just going to tell you, when you start your testimony, please state your name and your address, and Mr. Stevens will have a 3-minute timer for your testimony.
Thank you. My name is Jamie Thompson, and I live in Eagle. Good evening, Mr. Chairman, trustees, Dr. Rannells. Thank you for allowing me to publicly comment. I'm very concerned with this pandemic operation plan. What your idea of safety and science fails to address is the concept of a whole and overarching approach to public health policy, in this case for our schools. We are looking solely at COVID-19 and the impact on children, which in and of itself is very small. With this myopic approach, we are marginalizing a large segment of society who cannot provide at any level for their children's education, mental health, and sometimes physical safety. For those who are concerned with social justice, this should be a red flag, but for some reason, the fear-mongering has taken a front seat to compassion towards those whose primary safety is found in the structure of a functioning school. We know that even in this pandemic, school is still the safest place for the students. School is where they find structure and stability. Schools have developed protocol and procedures around COVID-19 that are effective. Why do we want to continue keeping our kids out of school? I can appreciate Dr. Pate is very proud of this plan, but some questions I have, which some questions answered, I believe, but for the definition of school outbreak, 3 or more clusters within a school within a 14-day period, should this not be relative to the size of the school in terms of square footage and also the size of the student population? Also, the criteria to get middle school and high school students back is again dependent on completely separate buildings and student populations. Theoretically, this means that when we are ready to reopen our schools, it will take a full 2 months for high schools to reopen. With thousands of seniors in the critical final months of school and ready to graduate, it would seem that this would be the critical population to get back to school first. Why are we not prioritizing juniors and seniors who are at major thresholds in their school careers? In every other major decision when it comes to school board, we have parent and student representation. Where is the parent representation on this COVID task force? And what about the students? This district has abandoned our students. This board has abandoned our students. Every single one of you have ignored the children. You have ignored the patrons. You have ignored the studies that say that schools should be open. You've ignored statistics around suicides and attempted suicides. You've ignored the fact that substance abuse is on the rise. You've ignored the fact that failing grades are up something like 87% since we've shut schools down. You've traded one issue for another by choosing to bury your head in the sand while allowing an outside interest to use our children as political weapons. Let parents and students make a declaration of what they want to do. Give us a choice to go back to school. Open the schools fully. Thank you.
Thank you, Ms. Thompson. And the last speaker after the next one will be Jared Lucas. Ms. Thank you, Ms. Benson. As you make your way, I'm just going to let you know, please state your name and your address when you begin your testimony, and there'll be a 3-minute timer.
Sure, no problem. I'm Sheila Benson. I live at 1515 East Trevino in Eagle, and I have 2 high schoolers, one in the district and one I pulled out. And so I sent you an email asking if the students in the brick and mortar building would be allowed to return to classes full time. As was alluded to during the last meeting that I attended, where you adopted the idea of reopening the VSH so to accommodate the teachers and students who felt it was unsafe, and allowing the rest of us to kind of more or less return back to a normal situation. I never received an answer to my email, and then the virtual schoolhouse was closed, and I think Ms. Ozuna alluded to the timing of it. It's not fair to tell the parents that they have to make a decision with regards to the virtual schoolhouse, not giving them a clear direction as to where they're going from here, at the high schoolers at least. Why can't you make a decision to benefit the overwhelming majority of kids and their families? Why would the school ignore Dr. Fossey, Dr. Redfield, CDC, and the CDH that said school should be open for K through 12? Why are you following your own direction with this reopening plan? It makes no sense to me. Why would the district adopt a reopening plan that ties COVID-free younger grades to the return of high schoolers? You've got different schools, you've got different, it's just so disconnected. And, we're waiting on kids to be free of COVID so our kids can return to high school. In the meantime, they're falling out. They're not getting what they need. What is the science behind this? I just don't understand it. So why do you think it's sufficient to teach high schoolers in person only 2 days a week when we know the education is terrible and the emotional impact of isolation is devastating to our teens? I came here from California to attend school full-time. I came to the district. I emailed Brett Heller about the fact that my daughter did not do well with distance learning, and I've had to pull her out because of the back and forth and the yo-yo. Devastation and emotional issues cannot be overstated. You need to do something about it. We are depriving our children of their rites of passage, prom, homecoming, dating, graduation, school dances. Our children are regressing and becoming depressed and socially awkward. That won't change. You're creating the citizens of the future, and you need to. I'm going to finish because I had to wait 1 hour and 45 minutes to do this. So teens have only a finite time to form their sense of self and their place in the world. They have to prepare for college, and 2 days a week isn't going to cut it. You are a school district charged with our children's education, and you need to take it seriously. If you don't have the time to do it, resign or do something. But don't do this to our children. It's just horrible. And I just want to make that really clear. If you all feel that strongly about being on the board, then do something and stand up for our children. Thank you.
Thank you, Ms. Benson. Okay, Mr. Lucas, as you make your way to the podium, when you begin your testimony, please state your name and your address, and then there'll be a 3-minute timer for your testimony.
Sure. Good afternoon or evening. My name is Jared Lucas. I live at 3008 South Berman Way in Eagle. And thank you for letting me have some time today. It's a little socially awkward for me to meet you guys in this way. I hope we could meet in a different way. I just don't know what forum that would be. So I was thinking today, I went out on a walk, and I was really struggling with the idea of should I come? Should I come in front of the school board and share my feelings? I have 6 children in the district. I have 2 in elementary school, 2 at middle school, and 2 at high school. Rocky Mountain, Sawtooth, and Willow Creek. And I treasure the teachers that are taking care of my kids. And I also sincerely appreciate the volunteer service this board gives to do the best they can for our children, and also the superintendent and her staff. And I really didn't want to come. I'm a Christian, and I believe in turning the other cheek when I feel like I've been wronged. But at the same time, I think it was important for my kids, because I may not be the former CEO of St. Luke's Medical System, but I am an expert on my family, and I'm an expert on the outcomes that I've witnessed since school started. When the school year was delayed, it was like a 2x4 across my face. I haven't been active in politics. I didn't understand what was going on, and I started to pay attention. When the plans have changed frequently, when the laptops didn't work, when the teachers struck, I stepped back and I said, there's something wrong. This is a wonderful community. Boise area is the #1 economic growth center in the country. We have sophisticated people here. Why is this fractured? Why are the outcomes bad for the students, for the parents, for the teachers, and for the board? I witnessed a board member storm out of a session because he was so frustrated with all of you. And I thought, how could this be? How could these outcomes be so bad? And I remained pretty frustrated. I'm stunned that Dr. Pate's given 2 hours. 2 hours. That's one voice. One voice. And I'm also deeply insulted by the insinuation that the 75% of parents who want their kids in school are unintelligent or anti-science. And that's the impression we get because we have no forum, we have no voice. And ultimately, that's the outcomes that we need from the school district. And the board, there's a couple elephants in the room. Your job is to hire the superintendent. Her job is to run the district. And there's a massive melding of responsibility here, including Dr. Pate, because I'm not sure why we're outsourcing the school district plan to him. And so I humbly call out this elephant in the room. Dr. Randall's contract is in July. She needs to be released. That's an elephant in the room. Everyone knows it. And I bless your heart for coming back. Bless your hearts for unretiring. But this pandemic and the associated outcome is greater than the skill set that you have. And that's the reality. And then the other elephant in the room is the recall. Chairman Newhoff, the recall has been certified against you. I've walked the streets of your zone. I live in your zone. It's not close. It's not close. We're looking for you to step down and resign. Don't put the district through a political campaign. The people have spoken, they've signed the petitions, and they clearly want you to step down. So I ask you humbly, on behalf of my family, as a citizen of this community, we need better leadership. Thank you.
Brings us to the action portion of the agenda. And the first item is revised policy 803.20, disposal of surplus real and personal property. And I'll entertain a motion. Trustee Johnson.
Thank you, Mr. Chair. I move that we adopt revised policy 803.20, disposal of surplus real and personal property.
Thank you, Trustee Johnson, for the motion. Is there a second?
Second.
Thank you, Trustee Ozuna. Is there any discussion? Seeing none, I will entertain a vote. All those in favor, please say aye.
Aye.
Aye. And it's unanimous. Oops. That brings us to action item number 2, which is the pandemic operation plan. And I'll entertain a motion. Trustee Klopfenstein.
Thank you. I move that we approve the pandemic operation plan as presented by administration.
Thank you, Trustee Klopfenstein, for the motion. Is there a second? Hearing none, the motion dies for lack of a second. Is there another motion on the table? Trustee Ozuna.
Mr. Chairman, I would move that we call a special meeting to approve the pandemic operation plan, which will give us a little time to review that additional section that we did not go over tonight, as well as give the staff time to get a legal review on the section related to the mask exemptions.
Thank you, Trustee Ozuna, for the motion. Is there a second? Thank you, Trustee Buffy, for the second. Is there any discussion? Trustee Johnson.
Thank you, Mr. Chair. I want to echo, I think, where Trustee Klopfenstein was trying to go, which is I think we all do support this plan. So this is not an indication of the support. I think it's just covering those bases of those last few items. And I don't know if in the motion, I have a question for the motion maker. If we had any other changes that the district caught, would those be also something that they could review and put in the plan? Is that the intent behind the motion? And the one I'm thinking of is the CDC to CDH change around quarantine, some of those kind of small things.
Mr. Chairman, I'm fine with that. I think the intent of wording it the way that I did was I'm not suggesting that we reopen this plan for major changes.
Is there any other discussion? You're done? Okay.
Oh, yeah, sorry.
All right. Hearing none, then I'll entertain a vote. All those in favor, please say aye.
Aye. Aye.
Aye. Any opposed?
A nay.
And it passes 4-1 with Trustee Klopfenstein being the nay vote. That brings us to adjournment. I would entertain a motion. Trustee Johnson.
Mr. Chair, I'm going to make that motion, but I'm going to take a little liberty here and just say thank you to everyone who put the plan together, and also thank you to all the board members, because this was not an easy, this hasn't been easy, and I just think I appreciate all the work that everybody has put into it, both from a district standpoint and also the reviewing and reading and thinking that has gone on at the board level. So thank you, and I'll move to adjourn.
Is there a second?
Second.
Thank you, Trustee Ozuna, for a second. I do have some discussion. As the last person mentioned, the recall has been certified against me. I have until tomorrow to decide, and I've spent a lot of time thinking about this, and a lot of me doesn't want to, put up with bullies like the people that are leading this recall. And in general, I would stand here and stay on the board and fight. But as it would happen this afternoon, as I was pondering all this, something happened that made me realize there are other things in my life that I need to attend to. And so while I would dearly love to sit and fight these people at the polls, I think it's the right time now for me to step aside and take care of the rest of my things. So after the meeting, I'm going to hand the clerk a letter of resignation that goes into effect at 11:59 this evening. It's been a pleasure serving with you all, and best of luck. All those in favor of adjournment? Aye.